Welcome to Board Certified, expert interview episodes about medical licensing exams and healthcare careers. I'm Tyler, founder of Achievable, and we offer affordable adaptive online prep courses for the USMLE Step 1, MCAT, PTCE, NPTE, and others. Each course contains everything you need to succeed, including comprehensive study guides, video lessons, thousands of practice questions powered by our memory enhancing algorithm, and full length practice exams. You can get a free trial of any course by going to achievable.me. And if you like it, be sure to use the code podcast to save 10%. Now, let's get started. Today, we are joined again by Immanuel Olarinde, and I'd love if you could introduce yourselves.
Thank you, Tyler. My name is Immanuel Olarinde. I am Nigerian. I was born and raised in Nigeria. I went to a Caribbean medical school and I started tutoring students for USMLE in medical school. It's around 2018. I've been doing that now since then, and I have thousands of hours logged just advising or teaching students for the examination. So I'm really excited to be here today. Yeah.
Yeah, fantastic. Well, today we're going to be talking about something I think is probably near and dear to your heart, right? Which is the challenges that international medical graduates face with USMLE prep. And I think the first kind of how I want to start this off is can you briefly explain who IMGs are and then why they would be getting involved with the US medical licensing journey at all?
Okay. That's very good. Thank you for that. IMGs are, I would say, medical graduates who study outside the United States.
Mhm.
So they don't have to be maybe US citizens or not, it doesn't matter. It just means that they went to a medical school outside, right? The US. So you have what called US IMGs, that is those that are maybe US citizens who study outside the US. They're also considered IMGs. And then you have the non-US IMGs, those who are not US citizens and also studied, right? Outside. Right, the US. But if you study outside the US, you're an IMG. And the reason IMGs are very important to I would say the practice of medicine in the US currently is because of the potential shortage, right, of physicians. So the US medical schools are not producing doctors fast enough to fill all the spaces, right, for
Mm.
doctors to practice in the US, especially in rural areas, right? The shortage is really getting worse. So US really banks on the IMGs to come into the US and fill those spots. Why they fill the spots? They practice there. They also gain experience that they can take to their home country, right? To improve the practice of medicine in their home country. So I would say it's a win-win situation. Yeah.
Yeah, well, I think it's super important. Like you said, there's so many qualified people abroad, and there's a shortage of doctors in the US, right? And so I think also then I mean, I think there's a little bit of this in your answer already, but like what motivates an IMG to pursue this career, right? To pursue working in the US as opposed to their home country or something else? Because it is a lot of work. It's challenging.
Yeah. It is. It is a lot of work. There are so many motivations. So I'll first of all speak from personal experience, and then I might chip in some other stories, right, that I've heard before. So from personal experience, for instance, of course, I was raised in Nigeria. I was raised in a small town, a very small town, and when I was a kid, there was a time I had an injury on my hand, for instance. I had a cut, and you can still see the scar a little bit on the screen. Yeah. So when I got to the hospital, I was attended to, of course, by an healthcare practitioner, sutured me up, etc. But what happened was that I had like a big scar, after that, and I even had some iodine burns and stuff. But when I got to med school, I found that I shouldn't have that scar, right? If it was done
Right.
properly, I shouldn't have the iodine burn. And till today, when people see my hand, the first thing they see is what happened to you there. I'm like, I shouldn't have it.
Well,
Okay.
and you're like
So
you're like I wouldn't do this to myself if this role were reversed, right?
I wouldn't do this to myself. I wouldn't do this to another person. I wouldn't want them to have this memory, right, of this scar of that event. So, and it just comes down to, not having well-trained, I would say, healthcare professionals. And sometimes you want to be well-trained, but you're in a situation or environment where there's no resources or there's no knowledge. When you don't know how to do something better, you cannot really make an impact. Like, you don't know how things can be done better. For instance, you're in the same system, you're training the same system that does things not so well. The resources are scarce. You don't really know how to do it better. You're just gonna repeat the cycle. Okay. So when I got to med school and I started seeing, okay, it could be better. I see US trained doctors. I see how they suture patients. I see how they close surgery. I see how they just approach general patients, and it's just so different. It's better. It's more efficient. They look like they know what they're doing. They give the patient better quality of life, right? I come from a place where people see surgery as a death sentence. Like, nobody wants to go to the doctor, or they would rather just stay away from surgery. So you not get to and you think, growing up, you think that's the norm. Oh, surgery is just that hard, right? That's what you think. But then you get to medical school and you see surgeons that are doing amazing things and people are surviving, and you start questioning, okay, it can be better. It's not supposed to be a death sentence. So, that kind of contributed to, okay, I want to go where they can do this better, and then I can bring it back home. Right. Because I lost my dad, for instance, to like poor healthcare, and I just have this zeal to, like, I want to make things better. I want to go where they can do it better. They know how to do it better, and I can bring it back home and translate the same thing. So that's one of the things that really, fills me, and that's one of the reasons why I would like to really train right in the US and go through the whole USMLE journey, no matter how hard, right? It is, right? So for other people, there's so many other, motivations. Some people, it could be a great means to come out of, financial poverty or something like that. Because if you're a US trained physician, I bet that you'll be in first in line to get any job in the world, right? Compared to other physicians. So everybody has different motivation, but for me, it's more, I think, more personal from my story. Yeah, it's very
Yeah.
personal.
I think that makes a lot of sense. And I mean, honestly, like, yes, I'm sure that the financial motivation is important for some people, but I bet you that it's a lot more stories like yours and other things that are really the key
Yeah,
for many of the people, right? Because it's very challenging. And I mean, that's one of the first things I wanted to talk about. When we did our last recording on the USMLE steps, you mentioned that, in medical school in the US, you're basically taught how to go through the USMLE, which is the medical doctor licensing process in the US. And in, other countries, that's not the case because they're not taking that test. So, I mean, can you speak to that challenge and then also maybe just some of the other challenges that IMGs will uniquely face when applying for medical school?
yeah. There's so many challenges. The first challenge will be awareness, like you mentioned, awareness issue. You're not trained by your lecturers have not taken USMLE as an IMG. Like, most of them have not taken USMLE exam, if not all of them. You're right. They've never taken the exam. They know about it, but they don't know details about it. They don't know how the exam is structured. So you take tests in schools that are not structured, like the USMLE exam, right? So you don't really know or you don't know how challenging it can be until you started going through maybe USMLE materials, or even until you step into the exam hall. So that's one of the biggest challenges. And then you're surrounded by people that have never taken it. You don't have seniors that have taken it. You may not have seniors that are practicing in the US. So really, there's no information other than you go to the website and maybe what others are saying online. So you don't really get a first or real-time experience. So I think that awareness is one of the major things to want to get out of early on, right? For me, when I was in med school, I was very, very lucky to be housemates with a senior that knows about the USMLE. Right. That's how I knew about the exam very early. My housemate was a senior, and he was determined, and he's currently practicing in the US. He was determined to go to the US. So that's how I knew about the exam. Any chance he gets, it tells me about the exam. Any chance he gets, it tells me about the exam. So when I started my basic science too, I knew about the exam, and that was why I was able to buy my first aid, right? From the first day of basic science because I also knew about the exam and I wanted to go to the US. So it got me started early, right? But for those that don't really, know about it at all or know as much about it, I say that all hope is not lost. You have to do your research. Whether your people around you have taken it uh, or not, whether your lecturers know about it or not, you have to do your research. And thankfully, we're in the age of internet where there's a lot of vital and reliable information right online. So you can easily reach out to Achievable. Like, I believe they can reach out to you. I think that would be like a reasonable first step. I'm watching your podcast and you're talking about the exam. I don't know anything about it. I can easily reach out to you guys and say, okay, please, can you guide me? Right. So don't be afraid to do that. Right. You can go to the USMLE website, get the information from the website. Right. You can go to YouTube and type it, and you'll actually see a lot of people talking about it and giving a lot of reliable information. So you must be able to do your research and get information about it early on. So I think that awareness issue is a very big deal, right? Very, very big deal. So that's the first thing I would say. So once you know about the exam, I think the next big challenge will be that combining the exam with other things. Whether you combine the exam preparation with your regular schoolwork, or you're combining the exam preparation with life, raising a family, right? Working. Some people are still working. They finish med school. They're already working 8 to 5, 9 to 5. Combining that with the exam preparation can be really challenging. In fact, that is one of the reasons why a lot of people drop out. Like a lot of people start the race, like they start preparing, but within few months or weeks, they stop because they just can't combine it, or they feel like other things come up. So I would say to address that, the first thing is you have to get to a point where you have to, in your list of priorities, the exam has to be close to the top.
Right.
You have to get to that point, right. When you figure out why you really want to go through the path, it has to consume you such a way that the exam has to be one of your number one priority. Because unless you make it your number one or close to number one priority, something else will become more important and you have a reason to stop preparing when it gets hard. That's the truth. You
Right.
have to. Right. So that's number one. Number two is don't do it alone. I know it's easy to say, although I have a partner, I have a family, I still want to study when they are asleep, right? And I don't want to tell them about the exam. I don't want to tell my family about the exam in case I fail. It's easy to say that, but don't. Let everybody around you know, people that care about you know that you want to take this exam. Let them paint a picture for them to understand how difficult it is and what you need to get it done. Okay, I need 4 hours of uninterrupted study every day for the next 3 months. I should be able to paint that picture. When you do, your family will be able to say, okay, if that is the case, this is so important to you. Okay, we can help you take up this task. I can babysit this for your kids, maybe during this period to give you that time. I can do this, and you get that support to get it done. So don't do it alone. Because doctors, people that go to med school, they feel like they're self-sufficient. Doctors are always, oh, I can do this myself. I don't need any support. I don't need help. Although they preach to their patients, right? But they don't do it. But don't fall into that trap. Tell everybody that cares about you that, okay, I want to do this exam and I need your help. I need your support. I need 3 hours every day. I need 4 hours every day. I need my weekend completely to myself. And you see that you'll be amazed how much people will come up and help you and say, okay, I'll take up this, I'll take up that to free the time for you. So I'll say that is very important. That's number two. Number three way to deal with combining is going to be accountability, right? It is easier for me to do something when I have to be accountable to somebody. Right. And you have to be accountable to somebody that you know will not take it lightly. Like they can talk to you, they can be honest with you, for instance, right? For instance, if I'm preparing for this exam and let's say I'm close to Tyler, but we are not maybe brothers, we're not very close friends. He's not going to lie to me, he's not going to sugarcoat anything. I
Mhm.
can talk to him and say, can you be my accountability buddy, my accountability partner? And
Right.
I'll come with you, I'll give it to Tyler, and every day I'll have to tell Tyler what I did. And Tyler will be honest with me. If I don't get it done, he will not sugarcoat and say, oh, maybe today was just hard. He will say, no, buddy, this is what you want to achieve. You're not serious. You're playing too much. You're doing this too much. You have to cut down on this. You have to focus. That's an accountability body. You have to get
Mhm.
one. If it's not a friend, somebody close to you, there are tutors. You can pay somebody. Especially if you know where you're going, you can find somebody to even pay to give you 1 hour of their time for you to be accountable to them, and they will give you honest feedback. I think it's worth it in the long run to do that as well. But accountability will help. After you prioritize, you get your family, close friends involved, know what you're going through or what you have to do, then accountability will be a huge one to really get you there, to push you right the extra way. Right. So those three things definitely will help trying to combine the preparation for the exam with other things, right? So once you're successful with that, oh, I'm doing good, I'm preparing well, I'm hitting my target, my accountability body or tutor is happy with my progress, right? I'm not complaining, I'm not missing too much days. So I think one of the next big challenge will now be keeping track of my progress, right? There is a lot of material out there, a lot. What should I use? When should I do this? When should I take assessment? When should I use Cuban? There's a lot of things. The first thing I'll say is nothing beats experience. I think it's important to talk to somebody, even if it's for 1 hour at the beginning of your preparation. Talk to somebody who has the experience in the exam, a tutor, somebody who have tutored so many people, somebody who has a platform, right? Reach out to Achievable. No, you have to talk to somebody. I think that would be the easiest way to kind of figure things out. When should I take a Q bank? When should I take assessment? Talking to somebody,
Mhm.
I think that's very important. Choosing what resources to settle on, that's another big deal. What should I use? There are so many resources. I think it's talking to somebody is just the easiest way. Otherwise, you might end up using 10 resources and you will not see, a result. So you have to really get comfortable talking to somebody, no matter how, even for 1 hour, talk to somebody early on and let them guide you. Okay, start with this, then go to this, then you track yourself, things like that. Now, having said that, one of the best way to track progress is going to be objectively, is going to be assessments. So I must take assessment to track myself. It is easier to track yourself with an objective assessment than to use your intuition. I feel I am stronger in biochemistry is not the same as an assessment showing that what you are consistently stronger in biochemistry. Right.
Right.
So don't go by feelings. You have to go by objective assessment or the objective evaluation of a tutor. Right. So when you want to start your preparation, I would say a lot of people are afraid to do this, but I would say start with an assessment. How will I know if what I'm doing is working when I don't know where I'm starting from? So it is scary, but it's okay. Start with an assessment first. You can take an endemic assessment. You can take a free assessment online somewhere to see where you are now before you start. So if I do an assessment, I get 30%. It's okay. It means I know 30%. I have 70% to master. That's fine. Now, from the breakdown, I will see the weakest areas and I will know what to start with. So when I start studying for maybe, let's say 2 months, I take another assessment and I will see. If my score jumps up to 50%, it means that what I did for that 2 months got me 20% increase. It's probably working, but then I need to probably do it more, better,
Mhm.
faster, more efficiently. So I know it's working and I'll do better. I'll stick to the plan. But let's say after 2 months, I take another assessment and my 30% is still 30% or drops to 20%, then I have to reevaluate. Whatever I've done for that 2 months did not work. I have to go back to the drawing board. So regular is very important. So take the exam without taking any assessment. No, they've underestimated the exam too much. You must evaluate yourself. Right. So I think that would be another major challenge that I really want to talk about. But otherwise, when you have all those things that I mentioned already, if you have them going for you and you really have a tutor that advises you and you're accountable, I think you will have solved over 90% of the challenges you face as an IMG. And then the other 10% could just be related to, the exam factor. Right.
Yeah, no, I think that's all. I mean, that you just listed a ton of really helpful stuff. I think I want to dig in on a couple of the things that you said. So the first one, you were talking about, one of your pieces of advice was like go get a tutor or go talk to somebody who's done it before. I feel like that can sometimes be pretty challenging, right? Because a lot of times, in the US, like you said, everybody does it. So it's very easy to find both of those things, but it's perhaps harder depending on what country you're coming from. So, do you have any advice for if people are challenged in that area, like what they can do, or maybe even, like how they can approach the problem of like getting advice?
Okay. Thank you very much. I I found that personally, I think it's easier for me to trust or at least be able to mm, gauge the trustworthiness of a platform that prepares me for USMLE if I follow them for a while. Right. So it's not going to be if I do my research, let's say I go to Google, for instance, I have no idea who to talk to. I go to Google and I search USMLE tutor, USMLE materials, and I have a bunch of lists. Let's say I listed five top based on their reviews, everything. I listed five companies or tutors, etc. I think what I would do next is just to follow them for a couple of weeks. I don't have to rush it. I don't have to start reaching out to them. I'll follow them. I can follow their social media, follow their podcast, follow YouTube, follow, and I will be listening to them. Anytime they put up a free material, anytime they do something that I can access, I will go through it. Now,
Mhm.
from doing that, believe you will start getting more familiar with one person over the other. Like your spirit will just, I believe, naturally start debating. Okay, I think this person is speaking my language. I think this person is addressing the issues I am struggling with. And then when you are convinced that okay, this I feel comfortable with this material, with this company, I feel comfortable with their resources, with what they're talking about, how they're addressing it. I've gone through student testimonials and everything. It just resonates with me. I can now reach out to that company and see how I can book a session and get more advice, right, to help me prepare for the exam, right? So I think you don't just jump into making a decision from the first instance. I think it's better to take a few days, follow those maybe top five or top 10, depending on how much time you have, that you're able to gather from talking to other people or doing a basic research, and then you can follow their platforms and see what they do and get engaged as much as possible. And you see that you start feeling more comfortable with one than the other, and then you can reach out, right, to what. Because believe me, the choice of making a tutor is highly personal, is highly personal.
Mhm.
What works for A will not work for B. So it's very important that you take your time to follow them and then you see where you really, I would say, align with, and then you go for that. Yeah, I would say
Yeah.
that. Another thing that can help with choosing, another thing that can help with choosing a tutor would be knowing what you want as well, right? I should be able to identify my weaknesses or identify where I need help with, if possible. And you can do that by looking at your medical school journey, for instance. This will not be the first exam you're taking in your life. You would have taken exams in the past and you would have known from experience, what do I struggle with? Am I the kind of person that procrastinates? I can get things done if I have supervision or if I'm more accountable, I have somebody checking in. If I'm that kind of person, then I would like to go to a platform where they have a tutor I can meet with at regular intervals. That will benefit me more than a self-paced course, for instance, because I know who I am. I'm a procrastinator, right? If my problem is that I can get things done, but it takes me time to really understand, I have to take my time to study, go through the video maybe a couple of times, understand the concept. I can get it done. I don't need to be accountable. I can actually get things done. I just need more time to understand. I'll likely go for a self-paced course first before I need a tutor, because I need that self-paced course to take my time, master the resource, and then I can now eventually maybe need a tutor later on when I need more explanations. So knowing yourself too can help you know exactly what you need when you're looking for a tutor. Yeah.
Yeah. Well, and I mean, I think the other thing, and what I don't know, I guess maybe wanted to hear more from you about is like, I think you can also find communities online, like some of the ones that we've talked to that seem to have a fair number of international medical graduates in them are, I mean, the foundation of IMG is one that I've talked to a couple times, and then AMSA, which is the American Medical Students Association, actually has a lot of IMGs. And I feel like there's probably even like Facebook groups or like Reddit or some other thing, right? I think you can look, and Achievable even has like our own forums for the USMLE. I think that there are other sort of outside the box places where you could potentially find community, and that can be really helpful.
Yes, 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 you're right. Yeah, the communities are very, very helpful. Yeah, yeah, I forgot to mention that, but what you said is like spot on. I think that's even one of the best and easiest way to get access to a lot of things you need and get the support, right? You need as well. If you're doing it alone, it's much difficult than if you have a community. Yes. So sign up for AMSAs, and from AMSA you jump to something else. From there you can find other communities. That would be very, very helpful. Absolutely.
Yeah, well,
Yeah.
because like one of the biggest, I think, challenges with this is just the dealing with feeling alone, right? Because you don't have like other people going through it with you.
Yeah. Yes,
Well,
that's one of the biggest challenge. I think no matter, like I used to tell my students, no matter what you're going through in your journey, somebody else would have faced it and likely have a solution, right, to it. So if you're doing it alone, you never get access to that solution quick enough. But if you're in a community, like you mentioned, somebody in that community would have access or would have gone through that same thing and they'll have a better advice, right, on how to do it correctly. Yes. So
yeah,
communities are
fantastic.
great. Mhm.
Yeah, so then the next thing I wanted to ask about was sort of some of the logistical things that IMGs have to overcome. The first is, I mean, pretty simply, just like the language barrier can exist for some candidates, right? And I mean, your English is perfect, so I don't think that was an issue for you, but I feel like for other people it might have been, right? And I'm curious if you have any advice on that. And then, yeah, let's start with that one.
Okay. Yes, that's very, very good one. Yeah. If English is not the first language, it's very challenging because understanding is a big part of the exam. Understanding what they're saying is very important. So the approach is usually you have to, well, I'll say first of all, how bad is it? So I think I would like to like break it down into how proficient, right, the student is in English
Mhm.
language. So there are those who are, I would say, below average in terms of proficiency, that they will really struggle to read any English text, to really understand the questions. I would say those can get additional help by taking like an English course. I think it will be very important to do that in that case. And also, it depends on how quickly you want to take your exam, right? So if I don't have a lot of time, I don't want to waste a lot of time taking my exam, I can take an intensive course to boost my English language before I start preparing for the exam itself. That would be more beneficial if I am below average. If my English proficiency is above average, I may not need a course, right? I may just need to surround myself with people that speak English. That can help, especially in a medical setting, right? Then another thing I can do is I can start using the text, the materials for the exams pretty early. Definitely English language, start going through questions pretty early to start getting familiar. I tell myself, don't be afraid to Google definitions. Like I'm going through a question, I see a word I don't know. I know everything, but maybe two or three words. Don't be afraid to Google it and get the definition and before moving on. Because I guess some people they won't do that. They'll just keep going or skip it or assume definitions. So if I'm above 50% proficient, I have to do extra work in terms of, okay, let me find the definitions of these words, big words. Let me clarify things that are not really clear. I want to surround myself more with English language speaking people, like especially in clinical settings, and that will help. I may not need a course, but that should be enough to help me break that barrier. But if it's below average, I'll say get an English language course, and then you now prepare for your exam after that. Yes.
Yeah, I feel like doing both at the same time would be way too much, right? Like you've gotta do one thing at a time.
Yeah.
Yeah, great. And then the other thing I wanted to ask you about, I feel like the other major logistical hurdle is just dealing with like visas and even like residency matching as you're getting later in the process. And I'm curious kind of like if you have any advice or how people should kind of handle that.
Okay. Good news is step one and two CK can be taken anywhere out most places in the world, like outside the US. So I should not let the visa basically bother me for step one and step two CK. I can still take it outside the US. I can take it in prometric centers around the world. But then for step three, you can only take step three in the US. So that's where it might get challenging, right? Um, from experience and what I've heard, most people find it really difficult to get the visa for step three alone. Like I know a lot of people get rejected for just coming to the US to take step three examination. IMGs get rejected, especially if they don't have previous history of coming to the US before. And I think the visa officer can't wrap their head around you're just coming to take a 2-day exam and have to give you a visa for 6 months or 1 year. So they get rejected. So I think one of the strategies some people use is that they don't take step three until they get to the US for residency, because applying for visa for residency is a increase your chances of getting the visa. But when you
Mhm.
get to the US, you take step three exam while you're doing your residency, right? But because you don't need step two to apply for residency, you only need step one and step two CK for sure. So when you apply for residency with step one and step two CK, even if you take it outside the US, you get to the US for your residency and then you take step three. Right. Now, having said that, don't let I would say, rejection, I would say, don't let it scare you. I think it's okay to go for it, because since step one is now pass and fail, programs are now emphasizing the importance of step three exam. So if I have an IMG who really wants to become more competitive with their residency application and they have a chance to take step three before residency, I would say go for it. Don't be afraid because of the rejection. Say go for it, apply, go to the for your visa interview and present your best self. Say the truth, present your story in the larger context. So don't focus on the exam itself, focus on your goal. I want to be a resident in general surgery. This exam will give me the best chance. Make my resume more competitive. I think a story in that larger context might be more believable than just focusing on talking about the exam alone, right? Yeah,
Right.
but it can be challenging though. Yes, to get a visa for step three.
Yeah. Well, that's great. Well, then, so I think to switch gears a little bit, I'd love to just talk about, succeeding as an IMG, right? And, part of that is succeeding on these USMLE exams as you're going through them. And then part of it is kind of like succeeding in your career after that. So, I mean, let's maybe start with the exam part of it. What are the things that you felt like helped you be successful as an IMG? And I understand, like, we already kind of in the other episode we talked about like how to just be successful with the USMLE in general. So maybe are there specific things that specific advice you'd give IMGs to be successful on these exams?
Hmm. Um, I think one of the biggest advice would be, which I've mentioned before, will be starting early. I cannot really emphasize how important that is, starting early, especially since you may have to combine your preparation with so many other things, combined with your medical school work. Starting your preparation for the USMLE early is a big plus
Mhm.
to success. Very important. You want to familiarize yourself with how the exam is structured, how the examiner wants you to think, which is different from how non-US medical schools, right, would approach their syllabus. Okay, so starting early is very, very important. I think that's a big plus.
Mhm.
I'd say that should be that. Number two, is you have to set a target. So what I mean by that is that, for instance, step one is now pass and fail. And the studies have shown, right? Data have shown that since step one became pass and fail, the pass rate has dropped for both US medical students and IMGs. And it kind of makes sense. So imagine before, when the exam was a scored exam, I can
Mhm.
set a target for myself. Like maybe I can set a 250 target. And for me to
Mhm.
get that, I will really work hard, right? To get to that 250. I'll work hard. And even if I have a bad exam day, I will not fall below maybe 230. I'll still pass. Okay. But now that it's pass and fail, you find out that students stop setting score targets. They don't set targets for themselves anymore. They don't set a score. They just want to do the bare minimum to pass. But when they have a bad day in the exam, right, what happens? They can drop below the pass mark. All right. So even
Mhm.
though it's pass and fail as an IMG, I don't think you should give yourself the luxury of just leisurely preparing for the exam, right? Even though it's pass and fail, still set a target during your practice test. So you can set a target for a practice test, still set that 250, 240. Although the pass mark can be 200, set it 240 for yourself, for your practice. So that in case you have a bad day on the exam day, right, you're still going to pass. Even if you don't get your target score, you're still going to pass. And instead of, working leisurely or just relax, being a little bit relaxed in your preparation, and you end up failing the exam. So set a target for yourself, set achievable goals, set that score no matter what, and try to achieve that. If you don't achieve it on your exam, you're going to still pass your exam because you've set such a high, right, target. So always set a score, set a target. I think that would be very, very important in preparing. I would say also don't compare yourself with US medical students. You're coming from different environments, different experiences, different
Mhm.
medical school. If I have a US medical student that is a friend of mine, very close, and he only studies for 2 hours for his exam, and maybe only studies for 1 month or a dedicated period of 1 month for his exam, I cannot compare myself to that. I'm coming from a
Right.
different environment. I have to set more realistic targets for myself. I have to assess myself, right? So don't compare yourself with other people. I hear a lot of stories, even on YouTube now. If you go to YouTube, you hear, especially for the SCORD exams, you see a lot of videos about, oh, how I got 260, how I got 270, how I got 250. But if you dig deeper, you find that those people have been studying probably from the first day of med school for that exam.
Right.
Those people are
Like effectively because
probably
they've been learning the topics and things like that. Yeah.
exactly. They probably have a CGPA of 4.9 and so 3.9 out of 4, and you have a CGPA of 3 out of 4. You cannot compare yourself. Your knowledge level is different. Your inclination, your orientation for the exam is different. So you have to set your own goal, your own realistic expectations. Not look at other people and look at what others are doing, and don't put unnecessary pressure on yourself, right? So I think those are very important, especially for IMGs to really succeed. It's to focus on yourself, start early, and make sure you set a score for your practice exam. Don't just be relaxed because it's pass and fail. Yeah.
Yeah. I think that's great advice and just like really helpful. I think like a lot of it's the mindset, right? And I think maybe that leads nicely into kind of the next part of the question, which is like, what are the things that you've seen other IMGs like yourself who have become medical doctors and who are successful? Like, what sort of are like the common things that you've seen among them, and kind of what advice would you give for people looking to start on this path that is not test related?
That's not test oriented or test
Mhm.
related. Um, oh my goodness. Something non-negotiable would be hard work. Uh, yeah, I think that's non-negotiable. There is no shortcut. There's no shortcut to success on the exam. And it's very important to know this because the exams build on themselves. So the foundation of step one is important for me to do well on step two. And the knowledge of step two is important for me to do well on step three. And then those knowledge are important for you to do well as a physician. And when you start taking other board exams. So you cannot, I would say it's going to be difficult for you to maybe downplay medical school, the first 2 years of med school, and then try to do really well on step one. It's going to be really difficult. So I would say hard work from early on, even in basic science, will be very important. It will set the tone nicely, right? For how you do, right? Not just in the exams, generally as a physician. So hard work is non-negotiable, for sure. Number two thing, I think, which is even more important than hard work, will be consistency. Oh my God, that is like the biggest quality, I think, even more than hard work. Because you get somebody who work hard for a week and they take a break for 2 weeks and then come back for another week. And now, but
Right.
compared to somebody who is consistently showing up every day, that consistency is huge. You have to be able to push yourself to study when you don't want to. You have to be able to push yourself to study when you don't have any support system. It's important because you may not have it all the time, right? So that consistency is going to be very, very huge, for sure. I think number three thing will be You have to be open and honest to those that really care about you. Because I hear a lot of these among even doctors and medical students. How are you doing? I'm fine, but they are dying inside, right? How are you doing? How's your preparation? Oh, it's going well, but they are really struggling. Right. So you have to identify, not everybody will be, I would say not everybody will care about you, but there will still be some people that you know that this person is genuinely right, interested in my success. So when those people ask you, it may be your attending, it may be a senior, it may be, somebody, big brother, somebody. Once they really ask you about those questions, be open. Because I think half of the problem is solved when you really talk about it. You may not really find a solution, but just talking about it, it relieves the stress and anxiety, right? So you have to be honest with people that really care about you. I think with those three, you can really go far and you'll be able to surmount any challenge, right, that you face, yeah, in this journey.
Yeah. Yeah, that's great. Yeah, and I think like my last question then is, if you could give advice to somebody at the beginning of both like their IMG and USMLE and medical school journey, and sort of like any kind of final encouragement, right, for people that are about to start on this and maybe feeling a little intimidated. Like what would be kind of your parting thoughts to them?
Your professors today were once students like you. I think that's important. One of the reasons why medical is challenging, I think, medicine as a career is challenging is because when you see the specialists, the professors, the doctors in the clinic, and you see how good they are, you start saying, can I be this good? And I'm still feeling this, I'm still struggling with this. Can I get here? But you should remember that they were like you before in the past. Or some of them were even worse than you, but they made it. Right. And I think that's one of the things that kept me going in school. When I'm about to give up and say, oh, this is so hard, because I'm really comparing myself to that professor who's just, it feels like he knows everything in the world and is perfect. Or I see the surgeon who is just so good. And you want to be intimidated and say, can I do this? It's overwhelming. Can I get here? But you just have to say, he was once like me. Some of them are even worse than you are when they were in school, but they made it, right? So you have to stick to the journey. You have to keep taking it one day at a time, one step at a time, one chapter at a time, one page like it's really it's just what you can do now. Do what you can do now, do it well, one step at a time, one chapter at a time, one page at a time, and then encourage yourself that you can get to where they are with consistency, because they were once like you in the past, and you can also get there. So I think that's going to be my biggest advice at this stage. Yeah.
Yeah, I love that. That's a great piece of advice, and it's a great way to wrap this up. Thank you so much. This has been
Thank
Board
you.
Certified, hosted by Tyler from Achievable with Immanuel Olarinde, MD. And Achievable has great online courses for the USMLE Step 1, MCAT, PTCE, and NPTE exams. And you can try them out for free at achievable.me.